All right, you're on, John.
All right, guys, thank you so much for your time. My name is John. I'm with Health and Benefits Partners. We keep this very informal. I'm going to go through this. This is your quote unquote open enrollment period for Gold's benefits. I have this presentation here for you. This is also available electronically through your portal at the end. Just some general housekeeping stuff. So here's our contact information if you ever need to reach us. You can always reach out to me directly or Adam. Highmark's information is in here. That's going to be your health insurance provider and then principal for all your other ancillary lines of coverage. General overview, who's eligible to participate in the insurance? If you are a full-time member of the team working 40 hours or more, you are eligible to participate in any of the benefits. If you are part-time working 20 hours, in between 20 and 40 hours, you are eligible to participate in the life insurance benefits here at Gold. General qualifying events. So if you waive coverage for today for whatever reason, so if you're covered under a spouse's benefit, a retired military plan, an individual policy, Medicare or Medicaid, or you simply sync insurance through a different channel, you would need a loss of coverage to come on the plan outside of your open enrollment period. So this is that time of year when you get to make changes to your benefits. Again, if you do waive for whatever reason, you would need a loss of coverage at a later date to come on.
Sorry, quick question. Becky asked me to ask if she's currently on her husband's dental and vision, but as is their son, but he retires in April. Is that a qualifying event because they will lose coverage? Okay.
Yep. Yeah, basically anytime there's a change to your insurance status is a qualifying life event. Also, but if you have a change in your own status, so if you become married or you have a child, those also qualify as events that would open up that special enrollment period that would allow you to come on the plan at a later date outside of this period. So if, in 3 months from now, they get dropped from that coverage, that opens up a special enrollment period where they'd be able to come on the plan with no gap in coverage. So it also eliminates that waiting period if they're within that waiting period, as long as they satisfy the duration of time in which they need to be with the organization.
Cool, thanks.
Okay. All right, so we have 3 really nice plans available to you. These are all through Highmark, Blue Cross, Blue Shield. So the way these plans work is these are all PPO plans. You do not need a referral to see a specialist. It is open access. There is no capitation through your primary care doctor. You can see doctors, specialists without seeing your primary care specialist for a referral first. The first plan we're going to touch on is this PPO Blue 500 plan. The way this plan works is you have a $45 primary care copay, a $65 specialist copay. There's a $2,500 front-end deductible for outpatient surgery and hospitalization. These are true copay plans. There is no co-insurance on any of these plans, meaning it's just simply copays and your deductible depending on the service you receive. All 3 plans include prescription drugs on the plans. It is a 4-tier drug plan. So you have your $3 preferred generic drugs, your $15 regular generic drugs, $55 brand name drugs, and $90 specialty drugs. This plan is $40 per pay for the team members. The next one is going to be your PPO Blue 1000 Gold plan. So the way the plans are structured, they follow the metallic tiers. So there's bronze, silver, gold, and platinum. As you can see here, you guys have a really generous benefits offering. These are 2 gold level plans and a platinum. Same functionality as the base plan with the $2,500 deductible, except this one has a $1,000 front end deductible for outpatient surgery and hospitalization. As you go down this list, you'll also notice the copays begin to get a little bit less expensive. So this is $30 for a doctor, $60 for a specialist. Prescription drugs are going to be very comparable. It's going to be $3, $30, $60, and $90. Urgent care is the same on both plans. It's just a $75 copay. You do not incur any kind of deductible exposure when you go to urgent care. So keep in mind for all 3 of these plans, the only time this front-end deductible comes into play is for your outpatient surgery and hospitalization charges. This plan will cost you $60 per pay. Is there any questions on the first two plans before we move forward? No? Okay. All right, so this is your platinum level benefit. This is the plan that is available currently, and this will continue to be available in 2023. This is the most benefits-rich plan available on Highmark's portfolio. This has a $250 front-end deductible. After that, again, it's covered at 100% for your outpatient surgery and hospitalization. You're $20 for a doctor, $35 for a specialist. You're now $40 for your urgent care. Prescription drugs continue to get less expensive as you go down these tiers. This is $3 for preferred generics, $10 for regular generics, $50 for brand, $85 for your specialty drugs. Again, all these benefits are open access. You do not need a referral to see a specialist. You do have out-of-network benefits. Those are listed down here at the bottom. If you do come across a doctor in the area or outside of your place of business and your home that doesn't take Highmark, you do have a true out-of-network benefit, which is very, very nice on all three of these plans. This platinum level plan will cost you $80 per pay. I would tell you there's a plan on here for everybody. So depending on your utilization of insurance, if you're a low-end utilizer, maybe you're just going to the doctor once or twice a year for your routine stuff. You want to have decent insurance. These gold plans are a perfect option for you. If you're somebody that might have something pending, maybe a surgery, a procedure, there's something coming down the line, or you frequent doctors often, you definitely make an argument for this middle level gold plan or this platinum level benefit. Before we move forward on the plans, is there any questions about any of the three plans, the functionality? You guys are shaking your head, you're good? All right, so I'm gonna move forward. So next is going to be your preventative services. So everything that's billed as preventative. So that's a list of all the preventative services. This is the women's preventative services. So basically all your routine stuff, anything billed as preventative, routine blood work, routine screenings, mammograms, pap smears, everything billed as preventative is at no cost to you. So regardless of the plan you're on, you will not incur your primary care copay for those preventative visits. There is Blues on Call. So this is a really nice, this is like case management for anything you have going on. So, let's say you're going through a treatment or you have something, pending, or, you just want to speak with somebody about an upcoming event medically related. You have Blues on Call that is available to you guys. Just call this number down here. It's 24/7, 365. We see a lot of utilization on this for like chronic conditions. You're going through long treatments. If you get sent home from the hospital, or you're given a bunch of different prescriptions after a procedure, you want to know the best way to go about handling the care, you can always speak with somebody over the phone by calling Blues on Call. There is a cost care estimator tool available to you. All these services are going to be available once you get signed up. You can go right to Highmark's website. The way the cost care estimator tool works is it's basically price shopping for things related to insurance. So, maybe if you have something going down the line, you have to get some kind of test, you want to see, what's the most cost-effective way. If you do it in a freestanding facility or hospital-based facility for a procedure or test or exam, whatever the case may be, you can put in what you're looking to get done, and it'll tell you based on where you're going to have it. If you go to location A, B, or C, what those costs to you are actually going to be based on the plan in which you're on. So think about it as like price shopping for things related to insurance. There is Blue 365. So this is fitness reimbursements and gym memberships and discounts for you guys. So Highmark's an insurance carrier, so obviously they want to incentivize healthy behavior, so they put different kinds of gym incentives and discount programs available to you. And then you can get to all this stuff by going through either their website or their mobile app when you log in. You also have telemedicine, so this is Teladoc. So this is great. If it's late at night, you're traveling, you're feeling too sick or achy to get out of bed, but you want to speak to a physician, sign up for their telemed services. You have 24/7, 365 access to a provider. They can actually help you over the phone for minor non-life-threatening things. Obviously, if you think it's something serious, you might want to consider urgent care over the emergency room, but this is an alternative to speaking to a doctor without having to go through your primary care facility, school, hospital, and emergency. Is there any questions on any of the Highmark benefits before we transition to the other lines of coverage?
No.
All right. Moving along. So Highmark is all your health insurance benefits, your prescription drugs, all on one ID. Everything else is going to be with Principal. Principal has your dental insurance. So the way the dental works is your dental is 180/50. What the heck does that mean? So it's 100% for all your preventative services. So twice a year cleanings, routine x-rays, they brush your teeth, they send you on your way. Those 2 visits you go to the dentist for every year are covered at 100%. There's no cost to you. Your basic services, so that'd be like repairs to existing dental work, fillings, minor extractions, all those services are covered under basic. You have 80% coverage. You're responsible for the other 20% on that plan. Your major services, so that's big ticket items, crowns, bridges, inlays, onlays, major extractions, you have 50% coverage. You're responsible for the other 50%. You have a $1,500 annual allowance on this plan, meaning Principal will spend up to $1,500 in your mouth in a plan year. Just to give you an idea, it's a very generous annual allowance. Most dental plans we see are usually around $750 to $1,000, so this one's $1,500 for everyone. That is per person on the plan. So if it's you, your spouse, your children, you each have $1,500. It's not like a family total, it's individualized. So if you have your spouse on the plan or you have children on the plan, each of you has that $1,500 per person to spend on your dental. Vision is with Principal as well. It is Principal's ID card. You'll get an ID card that says if you sign up for both the dental and vision. It is through Principal. They utilize VSP's network. So VSP is one of the largest networks of eye doctors in the country. It is VSP's network that Principal utilizes, which is really nice. The way this plan works is it's an annual benefit for all services. So every 12 months, you can get fitted for contacts or glasses. You can get your routine eye exam, and you can use your frames and materials allowance. Frames and materials allowance is $150 to use for prescriptions or contact lenses of your choice. And again, you can use that benefit every 12 months. There is life insurance offered to you guys that is picked up by the business at no cost to you. So this is 1.5 times your annual salary to $125,000. Again, this is no cost to you. You will designate a beneficiary of your choice. You can designate as many beneficiaries as you want. So if you have, 2 kids, you can split it 50-50. If you have 3 kids, you could split it up 3 ways, pick your favorite and give them that extra percentage, but you can designate anybody you want to be your beneficiary. You can also change this at any time of the year. So with your benefits, you have that open enrollment period where you get to make changes. On your life insurance, you can change your beneficiary at any time. So if you're not married now and you get married in the middle of the plan year, it might be time to transition your mom from your beneficiary to your spouse, or vice versa. If you're married and you are no longer married, please make sure you always keep your beneficiaries up to date, because whoever is listed, anything God forbid happens, is where those dollars are going. And then on top of the life insurance that is paid for by the business, you also have access to voluntary life insurance. So the business picks up the cost on the employer paid term life. This is going to be a voluntary term life policy. The way this works is you can purchase insurance in increments from $10,000 all the way to $300,000. It is guaranteed issue up to $100,000, meaning no questions asked. You can buy up to $100,000. Past that, so $110,000 to $300,000, they will ask you for a statement of health. It's just a questionnaire and just answer it honestly. They'll either approve you or deny you. There's no nurse that comes out to your house and takes your blood or urine or anything like that. If you are declined for whatever reason for the increments past that $100,000, so let's say you asked for 300, you got some health things going on, principal says, we're not willing to take on that risk. It just goes back to the $100,000 that's guaranteed issue. It also has zero impact on your life insurance that's picked up by the business. With the voluntary life insurance, you can also purchase it on your spouse and or children. For your spouse, it's increments from $5,000 to $100,000. You cannot have more life insurance on your spouse or your children than you do on yourselves. I know that's kind of sounds silly, but it's their rule, not mine. But you can purchase it. So if you have a spouse, it's guaranteed issue for them for $25,000. If you want to pick up life insurance on them, you'll notice when you guys log in, the voluntary life insurance is fairly inexpensive compared to buying life insurance on your own in the individual space.
I have a quick question about life insurance. Somebody actually happens to be sending me a message in regards to it. So all of the staff that receive the emails in regards to insurance and or life insurance, should everyone who is part-time or full-time, since we already have life insurance, we provide the regular basic life insurance, should they still be going on and at minimum filling out the paperwork for who would be the designated person to receive the insurance?
Yeah, so ideally we would want everybody to go in, complete it, because then you will have all the information all in one place. We'll have your beneficiaries on file, in the event that something happens. For whatever reason, if you can't get in, I can send you the beneficiary forms, which I think we already did for one member of the team, where you can have them on file. But ideally, in the perfect world, we would like everybody to log into the system just to go through it, designate your beneficiary. For the ones that are eligible for all the benefits that work for 40 hours a week, even if you're waiving the benefits, just go through, mark that you're waiving. That way, we have record of it. And then if you do need to come on the policy at a later date for whatever reason, qualifying events, it's real simple just to send out those links. But for whatever reason, if they can't get in, they'll still be eligible to participate. We'll just have to get some forms on the back end. But
okay, I just wanted to make sure I let her know that she should go on there and do that.
Yep. All right, so the next couple slides are just the rates for the life insurance, but you guys will see that when you log into the software. Next is there's an EAP program built into the principal benefits. So this is an employee assistance program. This is completely confidential. So if you guys are going through anything at home or at work or in your personal life, you want to speak with somebody, this is 24/7, 365. This is through Magellan Behavioral Health. It's completely confidential. No one at the business will find out about it. No one in our office will find out about it. It's between you and the provider that answers the phone. If you're not comfortable speaking with somebody over the phone, but you want to chat with them, you can also chat with them. You just go right to their site. You're going to put in principal's information because it's all linked through Principal, and you guys have access to their employee assistance program. You can log into Principal just like you can log into Highmark. So I tell everybody, register for these things. So go to Highmark's website, register your individual portals, go to Principal's website, register your individual portals. You always have everything in one place as far as your insurance related information. So your ID cards, your explanations of benefits, how close you are to maybe meeting that deductible, any, claims or billing, all those things are linked to those sites under your member ID number. So you can download their mobile apps, make it super convenient. You have your ID cards right on your phone. But this is the instructions to getting signed up for those principal benefits. And then last is just how to enroll. So for those who haven't had the chance to log in yet, everybody's been getting some emails from me or will continue to get emails from me during open enrollment. You just click on the link inside there, you go through it, put in all your information, you select the benefits in which you want to elect, and then you go from there. Everything will be all in one place through that software. This is where you'll designate the beneficiaries for the life insurance. You'll just click through the prompts, hit continue, and then it's going to ask you to electronically sign off at the end. Once you signed off, we'll get all the forms on the back end. You guys should be all set. Do you guys have any questions for me?
No, I think that for me, that kind of covered it. I don't know. I know Day's on here. Day, do you have any questions?
Nope, love it. Thank you.
Okay. And I think that too, it's important to let people know too, one of the qualifying events, we run into this probably more than anything, is when people turn, and I forget, is it 27 or 25?
Right in the middle, it's 26. So it's,
26.
so great question. So the way that works is when you turn 26, you have until the last day of the month of your birthday. So if today was your birthday, you'd have until the 31st to get signed up for insurance for the 1st of January. So they won't kick you off on the day of your birthday unless your birthday would happen to be the last day of the month. But you have until the end of the month of your birthday to sign up for the insurance. So that would be a qualifying event.
Okay, yeah, I just always like to make sure that people know that because there's such a short window of when they have to do it, but then also, people don't think about it until, it's
Yeah.
the day of their birthday.
The window of time in which you have, so like, let's say you lost your insurance as of January 1st, you technically have, based on the Affordable Care Act, 60 days to elect benefits, which will be retroactive back to the day in which you should have been insured. So there's no lapse in coverage. After that 61st day, though, that qualifying event window does close. So you have basically 2 months to get signed up retroactively. We can always do it proactively. So like if you know you were going to lose your insurance on the last day of the month and it's today, we can get you signed up ahead of time. It just won't go into effect until the 1st. But after that day comes, you have 60 days to make any kind of decision based on those guidelines.
Perfect. Kim, I don't know if you have any other questions? No. You're muted. Oh, I don't know what you're saying.
Yeah, I had to flip up to the thing to find.
Oh.
I was multitasking. No,
Oh.
I have not heard any other questions so far.
Okay, and you're pretty good, Jonathan. I mean, I know that I've reached out a few times with some follow-up questions and you get back to me right away. So if anybody has any questions, we can certainly shoot them over to you.
Yeah, don't be shy, and especially with the employees too. Like if there's something they'd rather ask like one-on-one, but not go through you back for whatever reason. But I'm always here. You can email me, call me, whatever the case may be, moving forward all throughout the year and continue from there, right?
Okay, that sounds great. And we'll just shoot any questions we have over to you.
All right, perfect. Yeah, so
We'll
I'm
have some.
I have a question that is not really related. I mean, it's related to insurance, but I just wondered if you're getting many people signed up yet.
yeah, so I can actually, so let me see. So I was
I'm
just
gonna stop the recording.